Hi, I'm Nicholas Short from the University of Texas MD Anderson Cancer Center. And at this year's ASH, we presented our data on a phase 1/2 study of the combination of ponatinib, venetoclax, and dexamethasone in patients with relapsed refractory Philadelphia chromosome-positive ALL. And so this is obviously a patient population where outcomes are very poor in the relapsed refractory setting. And the goal was to evaluate this entirely oral chemotherapy-free regimen in this population based on some preclinical data suggesting that the addition of venetoclax might synergize with TKIs such as ponatinib. So this is a phase 1/2 study. We're reporting the phase 1 data. The regimen is so basically patients receive the combination of ponatinib initially at 45 milligrams daily. And then with venetoclax, which would ramp up to either 400 milligrams for patients in dose level 1 or 800 milligrams for patients in dose level 2. And then each cycle, patients receive four days of 40 milligrams daily of dexamethasone. And then notably in cycle 1, there was also a 7-day lead-in of ponatinib, partly for cytoreduction and also to evaluate some translational outcomes of interest. And so we found is that this is actually a relatively safe regimen. There is some myelosuppression associated with the combination, but this is easily mitigated by holding the dose, for example, of venetoclax or delaying cycles. As I mentioned, we evaluated 2 doses of venetoclax, 400 milligrams and 800 milligrams. There were no dose-limiting toxicities. The maximum tolerated dose was not achieved. And so essentially we chose the 800 milligram daily dosing as the recommended phase 2 dose for future study. And so far the efficacy data looks very promising. So we've had 9 patients treated. These are very heavily pre-treated patients, the majority of which have had prior transplant, prior ponatinib, prior blinatumomab. Despite that, 5 of the 9, so 56% responded. And of those 5, 4 have achieved a complete molecular response, which we know is associated with better, long-term outcomes for patients with Ph-positive ALL. And although the follow-up is still short for this phase 1 study, it's been very encouraging that the first 5 patients who have responded, none of them have relapsed to date. And so we believe that this compares very favorably to data from, for example, the PACE study, which showed only a 1-year progression-free survival of 8% for patients with relapsed refractory Ph-positive ALL who were treated with ponatinib alone. So as of right now, this combination appears to be safe. Initially, it seems to be quite effective with a relatively high rate of complete molecular response. And so what we're continuing to enroll into the phase 2 portion of the study, and we're also performing some correlative work to better understand, mechanisms of response and resistance to the regimen.